Life doesn't pause when you're sick. Vaccines against respiratory illnesses can help protect you and give you more playtime with your best friend. Depending on age and health status, vaccinations for flu, COVID-19, RSV, or pneumococcal infection may be recommended. Vaccines can help keep you from having a rough time. Learn more at cveep.org/vaccines-protect. Brought to you by the American Lung Association and CVEEP, fighting infectious respiratory disease.
I'm a woman who thought she was doing everything right for her health until I found out at age 55 that I have osteoporosis, a serious bone disease. Yep, I was shocked. I eat well, I exercise, I don't smoke. I thought I was ticking the main boxes. But when I pushed my GP to order a DEXA scan, the results told me otherwise. And here's the thing. Osteoporosis is often called the silent thief. It sneaks up on you without obvious symptoms, and too often the first clue is a fracture. Today I'm diving deep into my story, the science of bones and menopause, how inflammation plays a hidden role, and what you can do to protect yourself. This is an important one because strong bones aren't just about avoiding fractures, they're the foundation of a strong, independent, vibrant life. Let's get started. Welcome back to Hot and Healthy Menopause. I'm Nicole van Hattem, your menopause coach and your retreat-loving guide through this midlife adventure. A few years before my diagnosis, I started noticing things. My joints didn't feel juicy anymore, and I'd say things out loud like, my fingers feel bony, or complain about pain in my wrists, toes, and ankles. It wasn't just the aches. My grip strength wasn't what it used to be. Some mornings, stiffness would linger long after I got out of bed. And then something happened that should have set off alarm bells. I kicked the wooden doggy door in my house by accident and broke a toe. Normally, that should heal in 4 to 6 weeks. But 4 months later, it was still sore. That wasn't a good sign. Thankfully, I had been tracking my menopause symptoms, and I added this to the list. At my next GP visit, I asked about bone health and requested a DEXA scan. Years before this, most of my symptoms were brushed off. My GP dismissed them as normal aging. I wasn't offered MHT, menopause hormone therapy. My inflammation markers weren't tested, and no one suggested a bone density scan. This experience of being dismissed, of finding out late, of realising I had to be my own advocate, is part of what drove me into specialist training and why I turned my health coaching service into a specialist menopause coaching practice. I didn't want other women to feel lost, ignored, or dismissed the way I had been. By the time I finally had that scan at 55, the results came back: osteoporosis with a high clinical risk of fracture. I was floored. What the actual fuck? And here's where it gets real. Under Australian Medicare, routine bone scans aren't offered until age 70 unless you've already had something break or have other high-risk factors like steroid use. If I'd waited for the system, I'd have gone another 15 years before this was picked up. By then, rebuilding bone would have been much harder. I'm one of the lucky ones. I pushed for answers, and that made all the difference. So what's happening inside our skeletons? Bones aren't dead sticks. They're living tissue, constantly breaking down and rebuilding. 2 types of cells do the work: osteoblasts, the builders, and osteoclasts, the demolishers. In balance, they keep bones strong. Bone density peaks in our 20s. From then on, there's a slow decline. Vertebrae compress, joints stiffen, aches creep in. That's natural aging. But menopause changes the game. During peri-menopause and the first 5 to 7 years afterwards, people assigned female at birth can lose up to 20 to 25% of their bone mass. That's huge. Why? Because estrogen, the hormone that directs calcium into bones and supports repair, falls off a cliff. Less estrogen means less building material and slower repair. Bones become porous. Joints lose lubrication. Pain increases. This is where 2 terms come up a lot: osteopenia and osteoporosis. Osteopenia is the warning stage. Bone density is lower than normal but not yet dangerously fragile. It's your early alert that something needs to change. Osteoporosis is the advanced stage where bones are brittle, fragile, and fractures can happen from the smallest knock or fall. Think of it as a spectrum: healthy bone, osteopenia, osteoporosis, fracture risk. The earlier you catch it, the more options you have to slow or even reverse the damage. So why is osteoporosis serious? It isn't just bone thinning. It's a serious disease with life-altering consequences. Here's why it matters. Fragile bones. Density decreases, leaving bones porous and brittle. Fracture risks. Even a small bump or minor fall can cause a break. And it's a silent disease, so no symptoms until it's possibly too late. And the consequences? Chronic pain, especially from spine and hip fractures, disability and loss of mobility, so suddenly even walking or dressing can become difficult, loss of independence. Many people with fractures need ongoing care. Increased risk of death. Hip fractures in particular can trigger complications like pneumonia or blood clots. This isn't just about bone density numbers. It's about whether you can keep living life on your terms. Let's talk about inflammation and bone loss. Inflammation is the piece I'd wish I had known earlier. When chronic inflammation is present, the body releases cytokines, which are chemical messengers. These stimulate osteoclasts, the bone demolishers, and slow the osteoblasts, the bone builders. The result? You lose more bone than you replace. So how did I potentially create an inflammatory state in my body without even realizing it that resulted in bone loss? I drank alcohol regularly. I leaned on caffeine to push through fatigue. I lived with prolonged high stress for years. My omega-3, 6, 9 balance was off. And yes, I did walk a lot and a lot of yoga, which are wonderful for well-being, but not the kind of exercise that impacts bones in a way that helps to build them. And I wasn't always well hydrated. On the outside, I looked like I was doing well. On the inside, my bones were under siege. Risk factors and family history. So who's most at risk? Women who hit menopause early, so before age 40. Those who've had their ovaries removed or went through medical menopause. Long-term steroid, thyroid, or breast cancer medication users. And yes, genetics. If your mother or grandmother lost height, developed a hunch, or broke hips or wrists, that's your warning. Family history matters. But remember, lifestyle can either add fuel to the fire or act as protection. There are other important triggers to rule out as well. There are other medical factors that can weaken bones, and it's worth checking them with your healthcare provider. Things such as thyroid disorders, parathyroid conditions, malabsorption syndromes like celiac disease, certain autoimmune conditions, and long-term medication use. So it's important to rule these out. Don't assume it's just aging. Ask for the tests, push for the answers. It's not just calcium. Here's another myth. Most people think osteoporosis is just about not getting enough calcium, but you can be eating plenty of calcium and still be losing bone. Why? Because calcium is just the raw material. To actually build bone, you also need vitamin D, protein, and hormones like estrogen. You need the right balance to get your calcium into storage. Otherwise, it's like delivering bricks to a building site with no workers to stack them. We'll go deeper into nutrition, exercise, and medical options in part 2. Get tested. Step 1 is always know your numbers. Ask your GP for a DEXA scan, and if you can't get it covered under the medical scheme, pay for it privately. Here's how to read the results. A result of bone scan of a +1 to -1, this is normal. From a -1 to a -2.5 is osteopenia, and below a -2.5 is osteoporosis. The scan is painless and gives you a baseline. Then you and your doctor can plan next steps. Don't wait for a fracture to give you the news. So let me ask you, are you brushing off any aches and stiffness as just aging? Are you tracking symptoms? Do you know your bone density right now? Did your mum or grandmum fracture a hip or lose height? Are you confident you're fueling your bones with the right nutrients? Not just calcium, but the full package. Awareness is the first step. In part 2, we'll talk solutions, what to eat, how to move, how to calm inflammation, and the medical options that can protect your bones. Thanks for joining me today. This was part 1 of our bone health and osteoporosis series. The story, the science, and the seriousness of this silent thief. In part 2, we'll get practical. We'll cover nutrition, movement, lifestyle strategies and treatments, and I'll share exactly how to calm inflammation so your bones can rebuild. Stay hot, stay healthy, and I'll catch you on the next one. Thanks for listening to Hot and Healthy Menopause. If today's episode helped you, please follow the show and share it with a friend who's also navigating the transition. And remember, you'll find my free menopause symptom tracker, retreat recommendations, and more resources at NicoleVanHattem.com. This is your time to thrive, and I'll be right here to guide you through it.